All right, let me give you a little overview of leukemia, some highlights, some things you might need to know for being a nurse, for taking a test for NCLEX. I'll try to give you what I think is important. Pathophysiology of leukemia. Basically, you have loss of cellular regulation in the bone marrow. Bone marrow is producing a massive amount of immature white blood cells, and these white blood cells are released into the circulation where they serve no purpose. Normally, our white blood cells are protecting us from infection, but these immature white blood cells that are produced at a really high number don't serve a purpose, so we're at risk for infection. The massive amount of production of white blood cells also overcrowds the bone marrow, so it isn't able to produce everything else we need the bone marrow to produce, which is, healthy red blood cells, platelets, and healthy functional white blood cells. So the underproduction of those will lead to anemia, thrombocytopenia, leukopenia, neutropenia, risk for infection, risk for bleeding, risk for anemia. Your leukemia can be acute or chronic. So acute is going to be sudden onset. These patients will typically present with like very severe symptoms, and they will die from complications of infection, bleeding, or anemia if we don't do intervention, we don't fix them quickly. Um, Chronic is a lot slower onset, and your body has more time to adapt, so people can live with this a little bit easier. They still need treatment, but they have longer life expectancy, typically a better prognosis. And then you can have lymphocytic or myelocytic, other subtypes. Lymphocytic or myelocytic, just referring to what type of blood cell is being overproduced. Your lymphocytes are going to be your B cells and your T cells, right? Your myelocytes are going to be your neutrophils, those other innate or non-specific white blood cells. This is just what we're going to see when we, find or do a biopsy, do our diagnosis, is like an overproduction of lymphocytes, but it's still going to cause an underproduction of the essential blood products that we need. So the disease process will be similar. Typically, acute lymphocytic leukemia is the one that kids get. And like I said, the acute leukemias typically have a worse prognosis, higher mortality rates. All right, risk factors for leukemia. There's definite genetic ties, familial history of leukemia that increase your risk. Also, some certain genetic conditions like Down syndrome, Klinefelter syndrome put you at increased risk. Definitely, chronic lymphocytic leukemia has a familial trait. And then also some exposure to like certain viruses, chemicals, drugs like previous chemotherapy exposure, and then ionizing radiation all put you at increased risk for development of leukemia. All right, so what are these patients going to look like based on their particular impairment? So if we're having a decrease in immunity, they're going to be at risk for infection, right? So they might present with frequent or recurrent infections, severe infections like sepsis, just really a difficulty of fighting off any infection and recovering from infection. Could be like a normal overgrowth of normal flora, like a fungal infection, thrush, something like that. Also, if we're having a problem with our platelets, they're going to have impaired clotting. They might present with bruising, unexplained bruising, diffuse bruising, bleeding, unexpected or unexplained bleeding, like nosebleeds, heavy menstrual period, rectal bleeding, and then prolonged bleeding, like they might get a cut and they bleed for hours. And then lastly, if we're having a problem with our red blood cells, they could have signs and symptoms of anemia, like fatigue, pale, um, decreased level of consciousness, sleeping more often, even can progress as far as dyspnea, chest pain on exertion if the anemia is really bad. The test that we're going to do on our leukemia patient, either for maintenance, monitoring, or diagnosis, start with a complete blood count. Hemoglobin hematocrit will be low. Platelets will be low, so clotting times like PTINR will be elevated. White blood cell count can be low, normal, or high, but typically the amount of white blood cells that are circulating are immature, non-functioning white blood cells. The patients who have a very high white count most likely will be diagnosed with acute lymphocytic leukemia, and they typically have the worst outcomes, the highest mortality rate, the lowest survival rate, they will have numbers that are elevated. White blood cell count is elevated, but it's not like 12 or 15,000, like something you would mistake for an acute infection. They're very elevated, like 50,000 sometimes, even higher, like crazy, crazy high numbers. And lastly, they're going to do a bone marrow biopsy. This is a great tool for the doctor to diagnose your leukemia, the type of leukemia you have, the specifics. It tells us your white blood cell counts, all of them, and in what stages of production they're in the bone marrow. So this is a very useful tool, bone marrow biopsy. So treatment options for leukemia patients is going to be a little different based on their acute or chronic, what type of leukemia they have. But most of them will be candidates for chemotherapy. Chemo causes bone marrow suppression. We're really trying to knock out their bone marrow in this disorder specifically because it's the problem, right? But the consequences, they're going to be really high risk for infection. We're going to knock out, all of their blood product production. So for a while they're on chemo, they're going to be very high risk for, thrombocytopenia, anemia, and leukopenia, neutropenia. So that just complicates things. They can also be a candidate for hematopoietic stem cell transplant, so bone marrow transplant, basically. You get a donor from like a sibling or a matched donor. And if they do get a bone marrow transplant, they may get radiation before that, just to make sure that we knocked out all of the problematic bone marrow cells before we give them the new ones. And then also through the disease process and the treatment, we're going to be offering supportive care like preventing infection, treating infection, preventing injury, controlling bleeding, because they have platelet malfunction as well, right? And then anemia management. They might be getting blood transfusions of any or all of these blood products during any point in this disease process. All right, to sum up leukemia, you can have acute or chronic, lymphocytic or myelocytic. It's going to make a little bit of a difference on the prognosis, the timeline, the treatment options. Treatments can be chemotherapy, bone marrow transplant, and our main focus is going to be these three areas as nurses. So either from the disease process or the treatments, they can have an impaired immunity due to leukopenia and neutropenia. So we're going to be focused on preventing infection and treating infection. They can have a decreased platelet production, so thrombocytopenia. We're going to be focused on safety, preventing injuries, treating or controlling bleeding, and then they can definitely have anemia, so decreased red blood cell production. We're going to be monitoring for complications of anemia, treating anemia. They can be getting transfusions for all of these blood products. Those are the three main nursing focus areas that are going to be highlighted for this disease process. All right, thanks. Good luck.